A necessary move to save a healthcare system in crisis or an attack on the public system Canadians cherish? That is the question after the Ford government announced plans to expand both the number and range of surgeries offered at for-profit clinics. Doctors and experts we've spoken to say there is both good and bad depending on how the plan is implemented and what protections are in place.
Doctors and patients alike have struggled in a system that really struggles to innovate, struggles to fix backlogs that should be fixable. Like these long wait times for simple things like knees and hips should never have happened.
There are more than 200,000 people waiting for surgeries in this province. The government's new plan promises to reduce wait times by moving low-risk procedures like cataract removals and hip and knee surgeries to private clinics, freeing up hospital physicians to focus on more complicated procedures. But the fear is this will worsen an already dire labor shortage inside of hospitals.
People will trickle down from the public sector to the private sector, whether it's because of pay, whether it's because of better hours. They may leave.
Nurses in the public system are facing wage restraint legislation that has docked their pay during some of the most difficult years to practice medicine.
They've had to live with what effectively amounts to a pay cut during a pandemic and, during a cost of living crisis as well.
Dr. Amita Ria tells us for-profit delivery of care is risky, and there are easily achievable public solutions that could reduce wait times, like expanding regional wait lists for the next available surgeon to more of the province, and extending OR times to evenings and weekends by hiring more staff.
We have over 100 publicly funded hospitals which have operating rooms, and generally these operating rooms shut down except for emergent surgeries after hours. So even if we were able to extend the hours a little bit in our existing publicly funded hospitals, this would mean we could scale up the amount of people who could get these surgeries.
There are also concerns about upselling. Doctors in private clinics can offer patients services that are not covered by OHIP, creating unexpected expenses.
We do see this more often in for-profit clinics in the community where, for example, you're going to have your cataract done, where we don't offer the publicly funded lens for your eye. We only offer the upgraded lens for your eye. And so before it becomes a form of upselling, something which we really have to watch because that undermines the whole principle of having a publicly funded system.
Those are consumer and patient choice options that are happening today, whether it is in community surgeons, hospitals. They are daily happening between a surgeon and their patient, and those will continue.
The health minister insists the motivation is not to privatize, but to expand access to care for patients. Meanwhile, a number of healthcare unions have already spoken out against the decision, but the Ontario Hospital Association says it welcomes the opportunity to collaborate between hospitals and surgical clinics. For City News, I'm Tina Yazdani.